First, I need to start out by describing what the disc is. This is representation of the lumbar spine, and the disc is essentially the cushion that connects the vertebrae of the lumbar spine. So this is a disc right here. The disc is comprised of two major elements. One is a collagen fiber that wraps all the way around, and within inside of that collagen fiber is what we call a nucleus pulposus, and that is what actually gives the spine its absorptive power. It's able to absorb shock. As we age, we tend to lose a lot of that nucleus because the nucleus is comprised of water, and the water tends to dehydrate over time. Approximately 25% of the population below the age of 40 has degenerative disc disease. Above the age of 40, at least 65% of the patient population or the general population has two or more levels that are affected with this. And when the disc becomes degenerative, we stop the ability to use that nucleus as an absorber, and the disc begins to collapse.